Australia is extremely well regarded internationally for its newborn hearing screening programs, which have very high rates of capture and very low rates of loss to follow-up. State-based screening programs are locally contextualised, with differences in funding, governance structures and leadership. Yet all of the programs across Australia have a family-centred approach, ensuring families are informed and supported throughout the whole of the pathway. A national approach is supported by the national framework, multidisciplinary leadership and collaboration across programs.
Different models of screening exist, yet consistent screening protocols are used nationally. There's a strong emphasis on the screening pathway, which continues beyond the last screening test. Informed consent is embedded into the screening pathway, and screeners are well trained, supervised, and must complete continuing professional development. Data collection, continuous monitoring, and ongoing quality improvement support tracking of children along the pathway and the evaluation of individual success and program outcomes.
Families are provided with unbiased and accessible information that enables them to make informed decisions about the communication options for their child and their preferred service provider. Early intervention programs adhere to family-centred principles with a focus on building the capacity of families to create natural language learning environments at home. Family-centred early intervention promotes collaborative teamwork, evidence-based practices that adhere to professional standards, accountability to families, and is an outcomes-based approach. Integrated services support a child's development across all parts of their lives, from listening to language, play, and social skill development to become an active communicator and member of their family and wider community.
Cochlear implant services are funded by state and federal governments. This occurs within an early intervention setting using a multidisciplinary approach. For example, ENTs, audiologists, habilitationists, psychologists or social workers work collaboratively with the family and child for candidacy evaluations, implant surgery, fitting and monitoring.
Family support helps families to navigate the newborn hearing screening system effectively and access the necessary services and support they need for raising their child with hearing loss. And the support really depends on the availability of high-quality formal and informal support services integrated into the newborn hearing screening pathway and beyond. Informal parent support is provided through trained parent mentors and parent-to-parent groups. Connecting with other parents really builds knowledge and confidence and acceptance of their child with hearing loss. Access and funding for parent-to-parent support services varies across the country.
Australia's Commonwealth-funded national organisation, Hearing Australia, provides equitable access to high-quality care. Fully funded comprehensive hearing services are provided for children with permanent hearing loss up to the age of 26, supporting them from birth until workforce entry. The organisation provides scaffolded training and mentoring for audiologists working with specific populations, including infants, children and adolescents. Family-centred services are delivered through a vast network of clinics across Australia. Our research arm, the National Acoustics Laboratories, led a comprehensive study showing that early detection improves outcomes.
Australia has national consensus guidelines on medical investigations and management of childhood hearing loss to inform and help families access and understand the medical testing options available to them and what these tests mean to the child and family. The guidelines follow a family-centred decision-making process and advocates for families to access the appropriate services to ensure optimal health, development and quality of life for their child.
Australia has a diverse mix of highly trained professionals across the hearing health sector. Professionals work in multidisciplinary teams and in complementary ways to support children and families to achieve optimal outcomes. University programs which train audiologists, speech pathologists and teachers of the deaf, for example, use a competency-based approach to develop and evaluate students within professionally accredited courses. Full membership to professional bodies is achieved through internships, which support graduates to achieve competence, confidence and independence in working with diverse populations.